So here are 5 ways to detect hypoxia in a setting where you do not have a pulse oximeter or you're in a very low resource setting. Hello, this is Dr. Shahalar. Today we are going to learn about the 5 ways we can detect hypoxia in a patient in a setting where you do not have a pulse oximeter or you are just in a very low resource setting. So the first sign would be cyanosis. It is a classic sign, and so if you're looking for central cyanosis, that must be in the lips or nose, or we can check peripheral cyanosis, that can be in the nail beds or earlobes. So the second sign may be tachypnea, which is also maybe the earliest signs, and more than 24 breaths per minute does indicate tachypnea, and it does indicate hypoxia. Number 3 would be use of accessory muscles. Now the easiest way to see that is just look at the chest and the neck area of the patient. So if there is suprasternal retraction or intercostal retraction, you can easily understand there is the use of the accessory muscles, which might indicate hypoxia. Also, which is easy, this can be easily understood in children if there is nasal flaring. So remember that for children, you're trying to look for nasal flaring, or if it's adults, you want to look in the chest and neck area for use of accessory muscles. Number 4 would be altered mental status. As we all know, our brain is very susceptible to changes in oxygen saturation. So altered mental status, which may present in as confusion or agitation, or like one easiest way to remember is new onset agitation may be an early sign of hypoxia. So one final tip may be look for the signs of sympathetic activation. What can you see in a patient where there is sympathetic activation? Cold and calm skin, and the patient is sweating, the patient has an increased heart rate. All these are actually signs of hypoxia too. So this is something we see in mostly emergency settings or ICU, that is asynchronous chest and abdomen movement. It is usually a very late sign, or it is seen in only emergency cases. One very helpful tip may be if you just ask the patient to say something or complete a sentence. The patient won't be able to complete a sentence because the patient is in a hypoxic state. Then you immediately know that the patient is in hypoxia. This I'm talking about when you are in a very low resource setting or you have forgotten about your pulse oximeter. But to confirm it, you of course need a pulse oximetry, or you need to do an ABG.